Let's bring in NBC News senior medical correspondent, Dr. John Torres.
It's always good getting that good news in, too, because we hear a lot of bad news about these things.
Absolutely. So when we talk transmissibility, how much do we have to be worried?
So what we're talking about is essentially what they call doubling time, which means how much time it takes for those cases to start doubling. And what Dr. Walensky was talking about this morning is the doubling time they're finding out from Omicron. And remember, this is preliminary data, is about 2 days. So it's actually between 2 to 3 days. If you look at the Delta variant, back in June, we thought it was around 11 days or so. Now it looks like it might be 5 or 6 days. And so it's much more transmissible, meaning that more people are going to catch it, more people are going to spread it to other people. That's the concern. But the other thing she mentioned, too, is we're starting to see lesser symptoms, which is good. And again, this is preliminary, so can't put too much faith on it, but less hospitalizations, less symptoms. At the same time, if we have more cases, that means more people will be hospitalized. Unfortunately, more will die as well.
Well, some good news came out this morning from Pfizer about that antiviral pill, and I asked you in the green room. So the pills will reduce death, you're saying, for high-risk people by 89% and by 70% for everybody else?
And like anybody else, any other drug company, they love names, and they call these ones Paxlovid, which don't ask me why. Wow. It just rolls off the tongue, right? But essentially what it is 3 different pills you take it twice a day for 5 days. And what they found in the initial studies were that for people who are at high risk of COVID-related symptoms and complications, that it cut the risk of hospitalizations and deaths by 89% if they took it early in the treatment course, meaning they understood they had COVID, they were tested positive. And so, again, it looks like it's doing really well. The other thing they found out, though, for people who are not at high risk, for those of us who are at regular risk, if you take it, it cuts it by 70%. And so, again, it's not cutting it quite as much, but still works well.
3 pills for 5 days.
Right.
If you
twice a day.
Have you ever had the flu and taken Tamiflu?
Sure.
It's the same thing here. You need to test positive. You need to do it early in the course, and then you'll get these 3 pills twice a day for 5 days. They will help cut down hospitalizations. They will help cut down deaths. For the non-high-risk people, it did nothing for symptoms. And so you're still going to feel kind of but at the same time, it could save your life.
When could we see this approved?
Well, right now, the FDA has the data. They said that they're going to go ahead and look at the data and then schedule the regular meetings they have. So my guess would be probably early on in the year, my guess would be January timeframe, only because we need these types of tools there.
And what about who should take this? I mean, or is it as efficacious for somebody who's vaccinated as opposed to unvaccinated?
They looked at both, vaccinated, unvaccinated, and the good news is it seems to work well on both people. But the important point is taking it early on. Much like the flu, you have to take Tamiflu early on. Same thing here. They said it works best within 3 days, which means that we need to ramp up our testing program so people can get tested earlier if they think they have symptoms at all, get on this medication, and that's when it'll help. Beyond 3 days, probably won't help as much, probably will help a little bit.
There's so much confusion now because even if you're vaccinated and with a booster, I know people who are getting breakthrough cases. How do you explain that?
And so what I always tell people is, remember, the vaccine is not a force field. It's not going to prevent the virus from getting into your body. But the way it works is once the virus gets in your body, it prevents you from getting sick from the virus. And so you might come down with COVID and you might test positive for COVID and you might even feel a little punky, but you're not going to get as sick as you would if you didn't have the vaccines. That's for the regular vaccines. For the booster shot, that adds even more benefit to that. And what we're finding out is the vaccines, even though they are wearing off in their effectiveness for preventing you from getting COVID, they are still really doing a really good job at preventing you from what I call the top 3, which are serious illness, hospitalizations, and death, which at the end of the day, exactly what we want.
That sounds like the flu to me, and not the flu, but how we treat the flu in the end.
Exactly.
That you get it and then you stay home.
Exactly.
But it's not.
And that's what's going to happen here. That's a great way to talk about it, because this is going to turn into what we call an endemic virus, which means the virus is always going to be here. We just need to treat it with things like the vaccine to hopefully prevent it, keep the complications low, and then these other medicines as well. My guess is for the rest of our lives, at least, this virus will still be here.
Incredible.
It's hard to kind of wrap your head around that.
It is, because it wasn't even here 2 years ago.
So CDC recommendations on boosters, what's the latest on?
So the latest recommendations, 18 and above, they recommend you getting a booster. 16 to 17, they say you can get a booster, but 18 and above, 6 months after getting Pfizer and Moderna, you're double dosing, and 2 months after getting your Johnson & Johnson, they recommend getting that booster shot. Again, partly because of the wearing off for Delta, but even more so because of Omicron that we know is going to come here. And like Dr. Walensky said, 13% here in this area here. And so we know it's going to be here. We know it's going to become more dominant.
You know, Doc, when you talk about this is something we're just going to have to deal with, is it going to be eventually like the flu, and then, in other words, every year we're getting a shot. We're getting a flu shot. We're getting an omicron shot or whatever
and that's
the
big
latest variant
debate.
is.
That's the big debate in the scientific community right now. Are we going to need this every year? Is it going to be 3, 5, 7 years? We don't know at this point. And the reason we don't know is because we put those 2 shots so close together up front to get everybody boosted really high to get us out of that emergency situation. And now we're spreading out the booster shot a little bit. And we think that's going to last longer than the year period. I'm hoping 3, 5, maybe 10 years next time we need one. It depends on variants, too, because we didn't see this Omicron coming.
Right.
And it came very quickly, so we don't know.
Really quickly, I think everyone's confused with the holidays coming up. Do we have people over? Do we have masks? If everyone's vaccinated, people got their boosters, do we have those tests in the house? Do people wear masks? What are your top 3 rules?
You know, the main thing is to make sure that you stay protected. If there's high-risk people in your house, it's a different story. That means the elderly or those that are very young and can't get vaccinated. But for everybody else, fully vaccinated, think about self-testing before people come over, because that can certainly help give you even more confidence. You don't need the mask unless you're outside in a crowded area or unvaccinated. And then if you're in a community with high transmission, think about putting masks back on. That's okay. Avoid poor ventilated indoor spaces. Try to go outdoors, open windows. And I tell people all the time, nobody before liked to ask this question. This is a perfect question to ask now. Are you vaccinated before you come into my house? Doesn't mean you can't come. It just means I'm going to change things when you do get here. And we're going to open windows, put masks on. Really
quick, Doc, do you think we should have in-home tests just hanging around just to be on the safe?
Yeah, I think that would be a great way to go, because I think that'd help everybody, number one, feel more confident, but number two, not spread it as much.
All right,
Thank you so much.
Dr.
You bet.
Torres, thanks a lot. We appreciate it. Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.